Thank you so much for inviting me to speak at your conference. It's a real privilege to be part of this virtual event. My name is Janet Newsham, and I am the chair of the UK Hazards Campaign, an organisation which campaigns and champions occupational health and safety and seeks justice for workers and their families harmed by work. As part of my work as the coordinator at Greater Manchester Hazards Centre, I support and advise workers, trade unions and employers on occupational health and safety issues. And in my presentation, I'm going to talk about some practical measures that should be put in place to address work-related stress and mental health harm. Next slide, please. The pandemic has brought many challenges for employers and workers across all sectors of employment. But for many people and most employers, COVID is just another risk that they face in the workplace. However, the overwhelming magnitude and seriousness has been a major factor. Health and safety law requires employers to identify and control the risks to the mental and physical health, including risks from infection, though perhaps in many workplaces the danger of not controlling the risks properly didn't have the devastating consequences that COVID has created. From the beginning of the pandemic, COVID has been centred in the workplace, health and safety, and as the terrifying and deadly tentacles of COVID-19 struck, where there has been a collaborative approach between employers and trade unions, workers have been safer, healthier, and so have their families and their communities. As we know, where they haven't, then they've been exposed to the virus and suffered the consequences. Over 14,000 workers have died, over 150,000 UK citizens have died, and hundreds of thousands have been infected. Workers' health is public health, and the virus transmission will increase where the risks are not controlled in the workplace, and workplaces include hospitals, care homes, schools, buses, trains, shops, canteens, etc. Increased risks in the workplace has been shown to spread the virus and place communities and our families in jeopardy. In England, outbreaks in Leicester's sweatshops hit the headlines early, and the meat processing and food processing plants across the UK and Ireland have been prime examples of rocketing infections in workplaces and communities, but these are not unique. There have been examples of individuals and communities placed at risk because of unsafe and unhealthy working conditions and practices. The recent outbreaks at Swansea's DVLA of the hundreds of workers, resulting in at least one death and others with long-term ill health, and that's just the workers, which has been highlighted in the fantastic work revealed by Professor Phil Taylor of Strathclyde University. But as we know, those workers will have infected their family members and members of their community, and no one is investigating, recording, or reporting those. The sheer unrelenting devastation caused by the virus to our work colleagues, families and friends and wider community is leaving deep trauma in its wake. Many hundreds of thousands have been left with serious and long-term, long-lasting mental and physical ill health disabilities, and it isn't over yet. Next slide, please. The known physical effects of COVID are still emerging. This helpful graphic produced by the BMJ provides a visual summary of the impact of COVID, and a recent report by Lancet has identified the neuropsychiatric implications of COVID. However, for many people, the fact that they were infected early in the pandemic, many weren't tested or hospitalised or have any formal diagnosis or record. Many are struggling to be believed, and even if they didn't have the serious symptoms, they've been left with long-term ill health and disabilities. Many will need reasonable adjustments to their work to ensure that they can remain in employment, and managers and all staff will need additional training to understand the physical and mental implications and the support that they need to give people. Next slide, please. So the work causes psychological harm. Work causes of psychological harm are nothing new. All too often, workers have been subjected to a combination of poor working practices, lack of resources, and too high expectations. What is clear is that how we're treated by our managers, or our employers, our work colleagues, and the public, how your work is managed and what demands are made of you, can have a massive impact on our health and our well-being at work. This is a list of some of the work causes that have been identified to us, not just from COVID-19. The Hazard campaign deals with workers from across all different sectors, and throughout the last year, everyone has experienced some of these harms. Every couple of years, the TUC, Trade Union Congress, surveys all health and safety reps across all sectors to identify the issues and concerns that they experience, and the increasingly work-related stress is the major harm in the workplace. The HSC, the Health and Safety Executive, has identified over 11 million days are lost at work every year because of work-related stress at work. But that isn't the full picture of the harm that is caused, because many more people don't take time off and continue to work or try to work. Presenteeism is a major concern in lots of workplaces and will continue to impact on their health and their work output until the crisis is reached. The effects of stress can be life impacting and life changing. It's not just a short-term illness, but can lead to more serious conditions. This is not an issue that can be stopped by head massages or yoga classes, as we see in some workplaces. We must stop blaming the individual for not being resilient enough, and start ensuring that our working conditions and practices don't make people ill or worse. Steve Toombs, an academic at the Open University, in his Better Regulation, Better for Whom, says that business harms are routine, systemic, and crucially avoidable. They are a form of violence, so widespread they've been called social murder, because they put communities, consumers, and workers in a position that they inevitably meet a too early and unnatural death. Next slide, please. So what can we do about it? We need to address these issues collectively. We need to ensure that our work activities are not causing harm. In my job role, I have spoken with workers in all different sectors who during the pandemic have been regarded as essential workers, and who before the pandemic were trying to survive on insecure hours, contracts, poverty wages. Workers sleeping in unhealthy housing, or even in their cars, or on friends' floors, or in the tents outside workplaces they couldn't afford to travel to. Workers that have been sacked for taking too long at the toilet, being taken away in ambulances because they were too scared to call in sick with life-threatening conditions. Workers peeing in bottles or defecating in plastic bags because they didn't have the time to move from their workstations, or they didn't have any welfare facilities available. The pandemic's highlighted the inadequate protection of many workers, many working people against risks at work, and how inequalities in society, those in precarious work, low wages, and inequalities in society, those with underlying health conditions, many related to their previous exposures to unsafe and unhealthy work, have increased workers' exposures to the risk of infection. There have been systemic failures in our occupational health and safety laws to protect workers and prevent harm. Next slide, please. Vulnerable workers, many working in multiple jobs without risks controlled. Inequalities highlighted the risks to health, disproportionate impact on older men, Black and ethnic minorities, some women in certain jobs, social, economic reasons, systemic racism and lack of PPE available, or workers wearing PPE not up to standards. In fact, we saw the standards reduced as workers became exposed, infected, and died early in the pandemic. And still, it's not good enough what we're seeing now. And now workers in many sectors are expected to wear face coverings, which is not PPE, not personal protective equipment. Our view in Hazards campaign is that we must take a precautionary approach to the health and safety harm. We start from the worst case scenario, and then as more evidence is revealed, more research done, we can relax the precautions. If this had been the case with COVID, then fewer people would have become infected and died. With mental ill health, we don't necessarily know who's in crisis, what other issues are detrimentally affecting their lives. What we do know is that we place unacceptable workloads on people, we expose them to trauma. If we bullying and infectious diseases, then some will suffer long-term and life-changing harm. This is entirely foreseeable and preventable. With a more focused approach, we can tackle the causes of work stress, And we know that more than 650 workers each year die from suicide. And there's thousands of workers that are suffering from mental ill health. And it's a huge cost to individuals, employers, and society. And we have a moral duty to ensure that it's prevented. Next slide, please. So we need a more strategic approach. Instead of diving in and signposting to services, we need to look at how we can prevent people suffering work-related stress, suffering harm. And that said, workplaces must support individuals and mental ill health. They've got a duty under the Equality Act to make reasonable adjustments, and also a duty of care under the Health and Safety Law. And finally, we need to change the way workplaces deal with work-related stress and mental ill health. Next slide, please. The HSC have developed a set of standards called the management standards. We'll look at those briefly in a minute. The key is to removing and improving stress at work is to put in place policies and procedures to control the risks of unacceptable stress. A first step is setting up a stress steering group, which includes and involves key stakeholders, including senior management, trade unions, and senior and strategic players. That everyone is trained in the management standards approach, which is a simple way of analysing and assessing the stress risks in your workplace and putting in place controls to remove the risk. Like any other risk, is controlled using a hierarchical approach. Finally, to include recording and investigating all stress-related incidents. This is a collective approach. It's one that the HSC regards as essential, and if employers fail to do this, they could be prosecuted. And we are told by the HSC that they're actively looking for cases where workers are being placed at unacceptable psychological harm. Next slide, please. So the management standards is on the HSC website. You can have a look at it, and it includes looking at the demands of the job, what the workload is, the patterns and the environment that people are working in, the controls. So what say you have in doing the job, what support is there, what encouragement is, a sponsorship to the job you're doing, are managers sponsoring you and supporting you, are there proper resources available, what's the relationships like in your workplace, is it positive, do you avoid conflicts, are you stamping out unacceptable behaviour like bullying, violence or sexual harassment? What's the role? What's the understanding of the role that people are undertaking? Is there conflicts in the role that they have? And how is change managed and communicated? So that's the basis of the management standards. And by doing this, you identify the main risks, you understand the underlying causes and how they can be prevented, and you implement change to control the risks. Next slide, please. We also have to recognise, as I said before, that there will be people in our workplaces with mental ill health or who have mental health conditions that are impacted by work and impacted by the pandemic. And equality law requires employers to put in place reasonable adjustments. Many trade unions have set up their own reasonable adjustment passports or disability passports. And these are to ensure that if a management changes, then work changes or people move around the organisation, there's an agreed reasonable adjustments that go with them, and that they aren't subject to renegotiation or the whims of individuals. It's a statement of needs that should be periodically reviewed in a supportive environment, and it relieves the stress caused by work into manageable and supportive approach. Many organisations have taken on board the mental first aid route and have trained first aiders with additional skills. But that's not protecting, not preventing the causes, and also doesn't identify those in crisis. Next slide, please. And finally, we need a positive mental health environment. All management throughout the organisation should be trained in mental health awareness. Young people in our organisations need additional support and understanding of mental health conditions. We need open conversations, and we need the stigma to be removed. Next slide, please. So in summary, I've put down in summary, our management needs to be reviewing workloads, we need additional training, flexible working, etc. Next slide, please. And that involves including trade unions and workers. We need to be confident that there's no recriminations by reaching out. April the 28th is International Workers' Memorial Day, and this year's theme is fighting for the fundamental right to safe and healthy work. No one should be injured, made ill, or killed because of work. We should all be able to work without physical or mental harm being caused.